Hello and welcome. I'm your host, Neil Howard, here on Health Professional Radio, and thank you for joining us again. In this segment, we're going to have a conversation with Dr. Joe Alvarnas. Joining us here is a hematologist-oncologist and VP of Government Affairs at City of Hope Cancer Treatment and Research Center. He's going to share a bit of his expertise on the drivers of cancer care inequity. Research suggests that more than a third of cancer deaths among all U.S. adults could be prevented if certain socioeconomic disparities were just eliminated. Welcome to Health Professional Radio. Dr. Alvarnas, thank you so much for joining us this evening.
It's a real pleasure being here. Thank you so much.
Well, I did, of course, mention that you are a hematologist-oncologist and, of course, Vice President of Government Affairs at City of Hope. What drew you to this industry? And talk a little bit about your role there at City of Hope.
So it's not the natural marriage of being a hematologist and also working in government affairs, but I think the latter was inspired by the former and patient experiences. I was really drawn to working with patients and families who were facing a cancer journey, particularly those affected by blood cancers like leukemia, lymphoma, and myeloma. And when I originally started my career, for many of these patients, the care that was available was simply inadequate to address their needs. And as we've had absolutely profound advances in science, more and more patients are living longer, better quality lives, and indeed potentially being cured of these dreaded diseases. The part of that, though, that really inspired me to think differently about what I do is that I heard and saw too many patients who got to the kinds of care that they needed too late. And I talked to family members whose brothers, sisters, fathers, mothers died because they couldn't get to care. And this idea of being able to extend the reach of what we do beyond the exam room and beyond the one patient and family before me became a huge driver. So this idea of changing policy that can help people down the road is something that I relish working in, because I think it takes everything that I've learned from every patient and family and turns it into something real and actionable for patients and families who have yet to face that cancer diagnosis.
What are some of the drivers of cancer care inequities?
Well, in fact, the answer is kind of complex. Mm-hmm. And there are things that related to our healthcare system and patients from underserved communities where resources like cancer screening, issues like health literacy, the availability of clinical expertise in communities close to home, those things aren't equal. And I think to the extent that they remain unequal, those who come from underserved communities bear a disproportionate burden of cancer and all too often suffer too much. When you add to that the toll of poverty and other social determinants of health, there's much that we need to transcend to get cancer care right. The other part of the equation, though, is that there's also differences in expertise. And for those patients with more advanced cancers or more complex cancers, being able to access a clinical trial or being able to receive care from experts who may be single disease experts in just that cancer type can also change the trajectory of how someone does. Mm-hmm. So I see this as two parts of the equation that have to be addressed in order for us to do just and right by patients and families throughout our communities.
In many industries, location, location, location. What do you say to those who suggest that inequities are just part of the location and the supply and demand of those services and not necessarily a policy issue?
Well, I don't agree, because I think that thinks that we in the healthcare industry only have one way to respond, mm-hmm. which is bring people to us. Mm-hmm. I think part of what's been the blessing and benefit of working at a National Cancer Institute designated comprehensive cancer center like City of Hope is that this idea that we need to reach into the community, that we do so by deeper investments in research, relationship building, working with community leaders. I think that's the right model. Mm-hmm. It isn't that people need to be where we are. It's that we need to be where people are, and that it's a collaborative partnership that restores people to wholeness.
SB 987, the California Cancer Care Equity Act. How is City of Hope involved in that bit of legislation, and why is that bill even being considered?
Well, that's a great question. You know, we started last year with leading the Cancer Patient Bill of Rights. And a lot of this was driven by clinicians in our institution who far too often saw patients who got to us too late. And this idea that patients couldn't get access, particularly if they needed a clinical trial or if they needed a specialized level of care, something that's so at odds with what we view as the right model of delivering care, that our top management, working in coordination with clinicians, really put together a Cancer Patient Bill of Rights that articulates what every patient and family who's facing a cancer diagnosis should expect. Part of those rights not only include having your diagnosis explained to you in a language and in a way that you understand, but also access to top-level expertise at an NCI-CCC, and also access to potentially life-saving clinical trials. Building upon that, the idea that this was affirmed by the California State Legislature in basically a unanimous vote of both chambers, it led us to realize that as we heard more patient stories, including stories from legislators whose families and friends had suffered from cancer, we knew we had to do more. And SB 987 is conceived as creating a right for patients, particularly in this instance, those who are beneficiaries of our state Medicaid program called Medi-Cal, to be able to benefit equitably from the top resources available to treat cancer today. SB 987 creates that as an affirmative right for patients rather than something that they have to struggle to achieve on their own.
Is that what will continue to happen if this bill doesn't get passed?
If the bill doesn't pass, then we keep fighting every day because, you know, the real heroes in this struggle are patients and families that are facing a cancer diagnosis. And honestly, there's only one villain, which is cancer. And we'll keep fighting, and whether that's fighting in each exam room and clinic and hospital bed to ensure that that patient and family can transcend the meaning of that diagnosis, that's the fight that we'll take. But also educating legislators in this state and indeed in this nation that we can and should do better, and that there's an enormous human toll of not getting this right. We're just not going to stop.
Is there anything that you'd like to add? And then give us a website where our listeners can learn more.
The thing that I'd add is that people's voices are really important. I mean, basically every 2 years we have elections here, and those who lead us are really willing to listen to the voices of their constituents. Far too often we don't exercise that right to educate legislators, to plead for the things that we need, and to demand the rights that we need. This is a great opportunity to speak out for members of your community, members of your family, that we can and should do better. And SB 987 is a small step forward, but unless you fight for it, we'll never make this victory real for patients and families. If people want to learn more about this, they can go to www.cancercarediff.org. That's www.cancercarediff.org. And it will tell you about other people's stories and also how to reach out and become part of the solution.
Dr. Alvarnas, I appreciate you lending us your time this evening. Thank you so much for joining us here on Health Professional Radio.
It's a joy being here, and I thank you again for the opportunity to talk about this.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Joseph Alvarnas, oncologist, hematologist, and VP of Government Affairs at City of Hope Cancer Treatment and Research Center. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.